Hi everyone, my name is Amit Tagger. I'm a bariatric surgery at Tampa Weight Loss Institute. Are you one of those patients that have had issues with weight loss? You've lost weight, you've gained weight. You're not alone. The vast majority of Americans are obese, and there's a subset of Americans that are morbidly obese. So this is not a one-person problem, it's an epidemic throughout the country. Here at Tampa Weight Loss Institute, we are a comprehensive program that specializes in weight loss. Whether it's weight loss surgery or weight loss medication, we like to do a comprehensive program to take great care of our patients, no matter what the need is for our patients. So a nice question that we always get, what is bariatric surgery? We hear about bariatric surgery all the time, but what does that really mean? Is it a surgery? Is it a type of surgery? Is it a multitude of surgeries? Well, bariatric surgery is just a comprehensive word to talk about certain operations that we do intra-abdominally or in your abdomen to manipulate your small bowel or your intestines or both in order to have weight loss. People also can call it metabolic surgery, and the reason they do call it metabolic surgery is that, yes, does it have weight loss? Yes. But two, we also have a lot of improvements on patients' medical illnesses. Let's say diabetes, hypertension, sleep apnea, fatty liver. So many different medical issues get resolved by bariatric surgery. So let's talk about the common operations that we do here. Well, there's a couple common operations that we've all heard of, and there's a couple that are not as common that some people haven't heard of, but we do here at Tampa Weight Loss Institute, and we actually specialize in these operations. So let's talk about the two that are very common: gastric bypass and sleeve gastrectomy. So a sleeve gastrectomy, we cut, transect, and remove about 80% of your stomach. That portion of your stomach comes out of your body, so you're left with what looks like a sleeve shape or a banana shaped type stomach. That reduces the ability for you to have inputs. You can't eat as much food. It also helps with a lot of metabolic problems such as diabetes. We don't manipulate your small bowel. However, it is irreversible. And the reason why is because we do remove that portion of the stomach that is transected. Great operation, probably the most common operation done in America. Once again, very, very safe operation as well. The second operation is gastric bypass. What we do with gastric bypass, we make your stomach about as big as your thumb, and then we manipulate your small bowel to bypass about 1 meter of small bowel. We don't transect or remove anything, so nothing comes out of your body, so it's completely reversible. We have about 8 to 10 meters small bowel, so if you think about it, all we bypass is a little over 1 meter of bowel. So the vast majority of your small bowel is just like it is today, and you can eat pretty normal. It's a little bit stronger than the sleeve gastrectomy and a little bit better for metabolic issues like diabetes and hypertension. So lastly, let's talk about two operations you might have not heard of as much, but we specialize in these operations. One is duodenal switch, and one is single anastomosis duodenal switch, also known as SADI operation. They're two different operations, but they have the same type of operation, meaning that both operations, first part is performing a sleeve gastrectomy. All right, so both operations, the first part is having a sleeve gastrectomy. Then we transect the first part of your small bowel, called your duodenum, and then depending which operation you have, we then bypass the majority of your small bowel. So for instance, with a SADI operation, we bypass about 7 meters of small bowel. So you have 3 meters of bowel that's just like today. We bypass a little bit more with 2 connections with a duodenal switch. That being said, both these operations are very safe as well, but different from the gastric bypass is that, one, the first portion, we have a little bit bigger of a stomach than a small pouch, we have a sleeve. The second part is we bypass more small bowel. So that's why this operation is the strongest operations of these compared to gastric bypass and sleeve gastrectomy, but not great for all patients because they can have some side effects long term. So how did sleeve gastrectomy become its own operation? And this will make a lot more sense when we talk about the SADI operation. So sleeve gastrectomy was actually made when we started doing laparoscopic surgery, and for patients that had larger BMIs, that means people with higher weights, and the technology wasn't great for small incision surgery, right? So what they decided to do is when they were gonna do the duodenal switch, they said, let's first do the top portion, which is the sleeve gastrectomy, and come back in a couple months to do the bottom portion. Well, they realized that patients were losing substantial weight with the sleeve gastrectomy. So that's how the sleeve became a standalone operation. So let's say you come to me, you had the sleeve gastrectomy, you lost good weight, maybe you didn't lose enough weight, or you gained a little bit of weight back. Well, what makes complete sense at that point? Well, you've done the first stage, which is the sleeve gastrectomy. Now let's come back and do the second stage, which would be the SADI operation or the duodenal switch. And that's what we really specialize in when we talk about doing a lot of SADI and DSs. And those patients that come that have inadequate weight loss or had sleeves and lost great weight but still have more weight to lose, well, now you come to us for that revisional operation because it makes a lot of sense. Not very many surgeons out there really specialize in this operation the way we do here at Tampa Weight Loss Institute. So who qualifies for bariatric surgery? This is a very interesting question because for the first time in my career, and the vast majority of other surgeons, this is actually changing. The old adage criteria, which was back in 1990, was that anyone with a BMI of 35 to 40 with a medical problem qualified for surgery, or a patient with a BMI 40 and higher automatically qualifies. So first of all, what is BMI? Well, BMI is a ratio between your height and your weight. How do you calculate your BMI? Easy. All you do is Google BMI calculator, put in your height and weight, and it'll come up with the ratio until you're at your actual BMI. So BMI 20 to 25 is normal, 25 to 30 is overweight, 30 to 35 is obese, and 35 and higher can be morbidly obese depending on What's now changed, which is very interesting to me over the last year and a half, since GLP-1s and semaglutides have taken over or have become a lot more common, is that insurance companies are trying to decrease that range for bariatric surgery. There are some insurance companies that decrease their BMI all the way to 30 for surgery. So if you look at the data, this has been accepted and shown to be standard of care by the big committees across the country and the world, meaning that ASMBS, who is our governing body for bariatric surgery in America, has said BMI 30 and higher are safe and they get adequate and the risk of surgery is minute compared to the benefits. Similar to IFSO, which is the International Federation of Bariatric Surgery, the governing body, they have all for years and years and years said BMIs of 30 and higher can benefit from bariatric surgery. So now the insurance companies are starting to go that route. The reason why is because of the weight loss medications are very expensive. If you look at 9 months down the road, weight loss medications cost the same as bariatric surgery. The problem is that now patients need to be taking these weight loss medications forever, right? It's not like one of those things where you can take 9 months of medications and you're done. In order to be successful with weight loss medication, you have to take weight loss medication forever. All the data has shown that if you get off your weight loss medication, unfortunately, you gain your weight back. So what is happening is not only are insurance companies paying a lot more money for medications for patients in the long term, well, when that patient has either increased costs, when the patient has side effects, or for whatever reason the patient doesn't want to be on medication forever, and they come off that medication, well, they gain their weight back, and now they have bariatric surgery down the line. So why choose us at Tampa Weight Loss Institute? I could go on and on. I was a surgeon for big corporations for the last 6 years and realized that, it just wasn't for me. I would go on and on about why I opened my own practice, but I'll be honest with you, the reason I opened my own practice because, one, I felt like what I wanted to give in my practice and what I wanted in the institute where I worked at was reflective of who I am as a person. And that's a family-oriented person, and I wanted patients to feel like when they have surgery by me, they're my patient for life, they have now my family. And that is represented on the people we hire in our institute. If you look at our program director, our dietitian, our MAs, if you look at anyone in our program, they've been with me for 5 to 6 years, and I brought them with me because they have that same philosophy in patient care. It's not just doing surgery and have a good life. Bariatric surgery is really taking care of patients forever. I would say about 30% of what we do for patients in their weight loss journey is actual surgery. The other 70% is dependent on how we take care of them before, during, and after surgery. And we have the best team here that will take care of patients the way they would want to take care of their own family members. And to me, that's very important. So when you have weight loss surgery by us, or just come to our practice for any reason, you're not just coming to a doctor's office, you're being invited to our family. Me as a surgeon, I've been doing this, like I said, for 10 years, from 2021 to current. I've been the #1 teacher when it comes to case observation for robotic surgery, meaning that surgeons fly across the country, even the world, to come watch me. I've had surgeons from Egypt, surgeons from India, surgeons from Spain, surgeons from Austria all fly down to come watch me operate. I have been lucky enough to do multiple courses throughout the country. I'm going to France to go do talks. So, my expertise in surgery really is one that I am very passionate about, and one that I think that should be shared around the country. And I think that's why I do such a vast job of teaching, because I really do think that, having surgical skill and being lucky enough to been trained the right way, as well as doing enough surgeries, that should be passed on to other people, and I do my best to do that as well. So expertise-wise, we are the leaders in bariatric surgery, not just here in the local market, but across the country. Another thing to think about is affordability. We all, as surgeons, see so many patients that go to Mexico or South America or other places to have surgery because it's much more cost-effective to go to those places. And there's a lot of really good surgeons there, and they do a great job with surgery. There's some that aren't, but there's a lot of surgeons that do a great job with surgery. Like I said before, bariatric surgery isn't just having surgery. Bariatric surgery is how you take care of patients in the long term. So even if patients have great operations, unfortunately, once they come back home within a day or two after surgery, they usually don't have any more support or significant support afterwards to really guide them through this long process of surgery. So here, we wanted to do our best to be as affordable as possible for those patients who didn't have insurance to cover their operations. So when I went into private practice, I did my best to be able to get very affordable and competitive prices. So currently, a sleeve gastrectomy by us is less than $10,000. Once again, that's a very competitive price around the market. Probably the lowest price here in Tampa, and one of the lowest prices in the state. And then our SADI operations. So there's so many patients that have sleeve gastrectomies, whether they have in the local market where all the surgeons do our sleeve gastrectomies, or they go to Mexico, or they go other places. And because of not having great follow-up care, or because maybe the operation wasn't strong enough for them, there's patients that come back to us and say, hey doc, I lost 80 pounds, but I want to lose another 60 pounds. Or there's patients who say, I just didn't lose enough weight. Or there are patients that, I lost weight, but I gained some weight back. I need another operation. Well, we probably have the lowest price in the country when it comes to the SADI operation, right? The SADI operation is the operation that the first part's the sleeve, the second part is a small bowel bypassing. Our price is $9,200. It's a very affordable price. We do this operation mainly outpatient. So for patients, obviously, with the proper past medical history and weight, we do these operations outpatients. And that's another thing here at Tampa Weight Loss Institute. The vast majority of our surgeries, whether they're sleeve gastrectomy, whether they're a gastric bypass, whether it's a revision, whether it's a SADI, whether it's a duodenal switch, they all can be done outpatient. What does that mean? That means you come in, you have your surgery, and within a couple hours, you're at home in your bed, relaxing after surgery, and you're not in a hospital, you're not uncomfortable on some uncomfortable beds, you can go right home. That does depend on, obviously, patient's past medical history, as well as patients' weight and BMI. But for the vast majority of patients, it has been shown through data that outpatient surgery is just as safe as keeping patients in the hospital for a night. The whole way of doing that is making sure you pick the right patients that go home versus the patients that stay in the hospital. And we are obviously understand that safety is our number one goal. So it depends on the patient. If patients want to stay the night, they can stay at night. But the vast majority of patients, if I give them the option to go home, they would rather sleep in their own bed that first night of surgery. And we allow that for all of our patients. And like I said, the data has shown that's very safe and effective way for weight loss surgery. So benefits of weight loss surgery. We all talk about bariatric surgery, we think about weight loss, right? That's all we think about, weight loss. We don't realize how many other factors that it improves of our health. I was talking to my really good friend a couple days ago, primary care physician. I told them, our price for getting off diabetic medication could be under $10,000. He was amazed. You say for under $10,000, patients can get off their diabetic medication? Absolutely. If you look at the data over the last 30 years, all these studies have been very, very concrete, showing that patients with diabetes have about 80% chance of being off their diabetic medication once they leave the hospital. Does that mean every patient's off their diabetic medication forever? No, right? Depending if you're on insulin, how long you're on insulin for, these all are factors that come in. But let's say you're a patient, you're on metformin for the last 4 years, your A1C is 7.2. I could confidently say the vast majority of those patients Their last dose of metformin will be the day the dose they take prior to surgery. And the vast majority of those patients after surgery will no longer be diabetic. And that's just diabetes. Let's look at hypertension. 6 months down the road, similar type of rates of resolution and improvement of hypertension. Sleep apnea. Most patients that aren't sleep apnea, don't have sleep apnea, and they are diagnosed prior to surgery, I tell them to rent their CPAP out, so they likely won't need it in 6 months. The one thing we don't think about is fatty liver disease. We all hear about fatty liver disease for getting ultrasound or anything to that degree. Well, studies have now shown that the only way to get rid of fatty liver disease is bariatric surgery. 80% of patients that have reversible fatty liver disease, their liver goes back to normal 1 year out from surgery. So it's amazing rates. I think we don't think about is PCOS. Patients that have PCOS. I have a lot of OBGYNs who send us patients because they have patients that are infertile because of PCOS. Well, look at the data. If you look at the data, you can see that the only true treatment of PCOS is bariatric surgery. We tell our patients who have trouble getting pregnant, make sure for the first year try to use protection, because I can't tell you how many patients 7 or 8 months said, hey doc, I'm pregnant, but I couldn't get pregnant prior to surgery. Obviously those patients do great. The babies also do great. If you have, we want you to wait a year after surgery just to get to your low point of surgery before having a child. But even if you have a kid before that, the child does fine, the mother does fine, no problems. We just want our patients to get to the lowest set weight, which is around 1 year post-op for patients. But it's pretty amazing. People who have infertile issues with PCOS, they can now have babies because they can have surgery. When we look at cancer, especially for female cancer, postmenopausal cancer like breast cancer, ovarian cancer that have to do with estrogen, these cancers are reduced about 60-fold for patients after bariatric surgery. And we go on and on and on. Almost every major medical issue that you have after bariatric surgery is either improved or in remission afterwards. So it's amazing. We think about bariatric surgery for weight loss, but I really want people to think about this health. Question I ask patients when they're not sure about surgery. I ask them one simple question. Where will you be in 10 years if you don't do something significant, right? Patients come to me at 50 years old, I'm scared about for surgery. They weigh, let's say 300 pounds, their BMI is 47, they're diabetic. Well, where are you at 60 years old if we don't do anything significant? We've tried to do the other way for the last 50 years, and then we're here today. So if you look at yourself in the mirror and realize, hey, this surgery can be outpatient, it's as safe as getting your gallbladder out, and it can give you the long-term weight loss and resolution of medical problems, it ends up being a no-brainer whether weight loss surgery is for you or not. So my favorite stories. I have so many patients I could talk about right now, but one that always comes to mind of one of my business success was a gentleman, nicest guy, came in and said, hey, 73 years old, he needed a hip replacement. He says, doc, I need a hip replacement. My orthopedic surgeon won't do my hip replacement if I don't lose weight. And I still like to work on roofs and do tile, and I like to be very active. I can't live if I'm not active. So I say, okay, you're 73 years old, we get medical clearance, cardiac clearance, he does great. We go do a gastric bypass on this patient. 6 months down the road, he has his hip replacement. 1 year down the road, he's up working on roofs. Still comes to the office, say, doc, how you doing? How's life going? And to me, that's the most heartwarming story I have of somebody who, you wouldn't imagine would be a great candidate at 73 years old. Most people are like, oh, you would do surgery for someone that old? Well, cleared by cardiology, cleared by everyone, had surgery, and now he's back to living his life and probably prolonged his life, at least 7 to 10 years down the road. So I have so many stories for my patients. I have so many amazing patients with amazing stories that I go on and on and on. But if you're a patient and you're thinking about weight loss surgery, or even thinking about medical weight loss, because we do that here too, give us a call. Here at Tampa Weight Loss Institute, we really are a program that invites you to our family for comprehensive weight loss. You can find us online at www.tampaweightlossinstitute.com or call us at 813-549-2392. Hope to see you soon.